So I just wanted to close out the meeting and wanted to thank everyone for a very rich, informative dialogue. Again, thank you, Dr. Well, we call her a doctor, but Dashida Dawson. I mean, it has been a wonderful 2-day event. I'd like to thank, again, Dr. Valerie Montgomery Rice, who is just exemplary in terms of her leadership style, and Daniel Dawes, who is the executive director of the Satcher Health Leadership Institute. Again, I guess next steps, Dr. Akintobi laid out next phase, we have been talking about what is to occur after the kind of the community-based participatory research efforts. And then, what's to happen? Some of you have laid out some great ideas, and I think it's great even talking to Dr. Fong. Maybe, again, he talked about maybe developing a pilot. Dashida Dawson also mentioned that she's working with the White House on developing a curriculum, and so has Dr. Knox. And Dr. Fong talked about that 1-week event. That is something that we could engage in and have a multidisciplinary, interprofessional, and very, cross-institutional engagement or initiative that we can develop. And that is the next phase. Immediately more for the Institute is that we are looking at, of course, developing the final report and meeting proceedings on what's been discussed the last 2 days. For the general public, we'll have more of a media opinion, editorial pieces that are developed. We'll have journal articles, white papers that are being developed. And of course, we are going to exchange information with you because you all, as some of you may know, are going to be that first kind of brain trust, right? You are the experts and you're the community members that are there. We call it community science, but you are going to be that consortium that we're going to build and exchange ideas with, because you have laid the platform that we know that we can work with, and you all have been invited here for a specific reason. And this season, right, it's right, especially here in Georgia. We talk about those western states. You guys are up and early, and so it's great. But having that place in the state where more recently some things have occurred with the political exchange, but then also with what's happening now in the medical cannabis space here in Georgia. And so it's kind of the preliminary efforts and what's happening, right? So what Dr. Akintobi talked about in terms of some community-based, ideas, what's happening with the stigma? How is it changing? What's going on? What are people really thinking? And so I think this is going to be very influential in terms of developing a program, a 1-week event, possibly or a training or curriculum that Dr. Fong proposed. And I think, again, we need to have that exchange. And so we're asking you to be part of this brain trust that will start to kind of formulate, and definitely you'll receive more information over the next few weeks. And we're going to link with sustainable policy agents, right? We talked with congresspersons today, and thank you again to Representative Buddy Carter and Representative Barbara Lee. We were so elated to have them on board in our efforts to talk about what's happening in the state and federally. And we want to make sure that they are engaged, of course, and additional new members that are coming on board, whether it be from New Jersey, California, Oregon, and Mississippi, and even Florida, and what's happening either regional and statewide and federally. And so we want to definitely thank you all. We want to thank One Joshua Group for being a great meeting manager. They were definitely on point today. Again, we want to thank you to all the event participants and the speakers. Looking forward to continuing our efforts over the next, we say next few weeks, but we know that this will be an iterative process. And we know as we communicate and talk, and Dr. Akintobi said, this is something that's going to continually be a snowball effect. And we know that all of us have worked with communities, and we know that it is going to be something that we need to get down and dirty with, and definitely talk with the community and have them lead the way, right? We don't want to lead it because that's not the place that we sit in, especially at Morehouse School of Medicine. We are community enforced, and we're led by the community. They know we are a trusting voice, and we want to hear them, right? So we want to make sure that we are all together. We thank you all, and please look out for more information from us. Thank you, and have a wonderful week. Take care. Bye-bye.